Human beings are social animals, you know. We evolved and survived as, well, quote unquote, the dominant species on Earth by hanging together as social units. Your feelings about affirmation, about you're funny, you're this or that, come from other people. And to continue to deny and abandon that is a difficult thing. One of the toughest things for a lot of people coming into treatment is they don't want to be in group. They don't want to talk in group. That's the hardest thing I can do. It's the most necessary thing that you can do, though. It's the hardest thing because you've gone through years of detaching from this, and now you need to go through a period of time of relearning how to do it and how to do it sober and how to do it constructively. Not interacting with other people for what you can get from them or take from them, but what you can interact and, you know, share in common. And this, you know, there's also studies done on the neurotransmitters regarding people that are involved in 12-step or recovery, ongoing regular recovery efforts, and those that are just staying straight on their own. And when we look at measuring the metabolic breakdown products of these transmitters that are important for the pleasure centers of the brain, these people recharge much more rapidly, doing nothing else other than this. So a combination of these things is very important to get your brain back to normal. Then lastly, about 20 to 25% of our patients have a dual diagnosis. In other words, not only did you inherit a problem with a chemical dependency issue, but you also inherited bipolar disorder, you have a family history of endogenous depression, or schizophrenia, or one of the psychiatric related disorders, meaning that you're more depleted than usual. And the medications that are used, if you don't need medication, you don't want medication because all medications, even the newer ones with minimal side effects, have some side effects. So most people, 75% of people can, remember me talking about the 1 quart low, they can make up for this 1 quart by doing 1 through 4 and doing it consistently. These people need medication to get them to here, and then doing the rest kind of gets them to here. These medications are designed to improve the manufacture of the neurotransmitters and to increase reuptake back into those nerve terminals. That's how they work. And they're quite specific in how they do that. I was talking about pharmacogenetics earlier, and what we're looking at now is we do genetic studies along with the medication studies, and we look at certain allele subtypes, in other words, different portions of the DNA that code for these brain transmitters. And historically, when somebody went to a doctor because I'm depressed or I have anxiety or I have this or I have that, you'd go through a whole series of medications before you could find something that really worked. And what we're trying to find out now is medications act differently. They act on ion channels and all these kind of things a little bit differently. And we're trying to match genetic characteristics with particular medications so that you don't spend 3 years looking for a medication, that you find something that is likely to be effective right now rather than going through this blind hunt, you know. Now, I think in the time we have left, I think I'll open things up for questions anybody might have.
So basically, people with bipolar or schizophrenia typically have less neurotransmitters that
Right.
work than the normal people.
Right.
Huh. That's what causes the symptoms.
Right. Yeah, that's, as I try to show in this graph, I'm not very artistic, but you know, when you're kind of down in this zone, you get 1 quart, 3 quarts low, somewhere in here. I'm just trying to graphically represent this, I guess, and you know, you get down into here, you can call this relative degrees of depression. Beyond depression, that's just simply from the transmitter depletion. Well, if you deplete too much, then the brain doesn't communicate with itself as well. And the next step below depression becomes kind of paranoia and unknown. The world really becomes an unknown to you. People, places, things become unknown. And your future becomes unknown. And when your future becomes unknown and there's no light at the end of the tunnel, things get worse. And then you get further down, you get into hallucinations and misinterpreting reality. That's really depleted. And that can either happen naturally because you inherited that, or you can create that by using so much you put yourself there, you know? So yeah, and that's what the medications are aimed at, is, you know, bipolar disorder, you have membrane stabilizing kind of drugs, and you have drugs that sort of recharge some systems, but a lot of it has to do with just stabilizing neurotransmission, you know.
As far as meth is concerned, I know for some meth addicts, after they experience the high, they go through several days or a week period of they can't enjoy anything. Is that
Right.
because they deplete a whole
Yep, that's exactly
week
it.
supply of...
Yeah. See, you know, to feel, you know, in the brain, you get the pleasure centers, and you know, everybody's heard of the classic experiments with rats when you put this electrode in the brain in the pleasure centers, and you connect it to a lever, and the rat will just keep pressing on that. They won't drink, they won't eat, they'll press on that thing until they die of thirst. And they keep pressing on it because it doesn't work as good after a while as it used to, because transmitters are running out. At some point, some of them will give up and some of them will actually drink then, but a lot of them will die. But yeah, that's what it is. When you've gone from like 8 or 9 down to 1 or 2, the world doesn't feel very good, and it doesn't feel very good until this slowly recharges. You know, and here's the thing I didn't talk about earlier, but the antidepressants, how they work is by recharging this system, by putting stuff back in here. However, they work very slowly. You use methamphetamine one time, you use up 6, 7, or 8 of these right now. Coming back in by itself, it's going to take a week to get 1 or 2 back. So you're a net defect if you're using more often than once every week. But the medications also, you know, for these medications to be effective, you have to be on them without using for at least a month or 2, because they're only going to trickle in like 1 or 2 a day, maybe not even 1. So the analogy I make there is if you try to treat depression or all of the symptoms of this stuff with medication, you know, while you're using, it's like trying to build a sandcastle on a beach with the waves coming in. There's just going to be a hole there. There's going to be a sandcastle there. The waves are going to dig a hole because there's a flood. It's a flood compared to a teaspoon.
And I guess I have one more quick question. For someone born a quart low, like you referred to, they find that they fill that quart with alcoholism or drug abuse, whatever. Once they get clean and are in recovery, they can feel that gap filled with exercise,
Right.
diet. So
If you do these first 4 things, you can probably fill that. In fact, I know you can, you know.
I was wondering how long it takes to have your brain go to normal.
Again, that depends on the individual, it depends on how much you're using, how long you're using, but just generally, it takes, for most people with most substances, about a month to start to get to be normal. And I think, you know, the traditional substance abuse model was 28 days, 28, 30 days. And there may have been a reason for that too, because at the end of that period of time, it seemed like most people were pretty much normal by then. They seemed relatively normal. And I would say that gets you to a point where you're functioning reasonably well and have the ability to carry on from there, you know. But with some people, this can take 6, 8, 9 months, a year, you know, with some of the heavy methamphetamine users we see, before their ability to perform memory and cognitive testing kind of function. You know, anybody that sees the data we collect on looking at what happens here knows that we look at a lot of things, and that can take like a year before you're really peaked out. And in some cases, you're functioning because you're using another circuit, you know.
I saw a chart the other day on the alcoholic allergy with the body, and like the craving produced seemed to do with the acetone level or something like that, and the enzyme level on each individual.
Well, there's a lot of different sort of theories about acetone, and there's metabolites of alcohol. I don't know if that has that much to do with it rather than simply transmitter depletion, but there are a lot of sort of lay theories out there, and people, there used to be, was the isoquinolone theory, and that when you drank alcohol, it combined with dopamine in the brain to form an opiate-like substance, and that produced the addiction. But I don't, a lot of that stuff just doesn't hold up too well. It sounds great, and it sounds complicated, and there may be a little something to it, but I think if you can understand it from the perspective of the impact these substances have on your transmitters and where those transmitters are, they're in the pleasure centers and the syndromes. When the pleasure centers become depleted of these transmitters, it's like a sponge crying out for water. It just wants to be filled up with this, and it's a very compelling and powerful thing, and it's a key element to treating addiction. Is how do we deal with that? Because that gets into the irrational part. Well, don't you know if you're going to use and if you continue to drink with your cirrhosis and your ascites and all these kind of things that you're going to die? They don't care. It feels so miserable that just a day or two of feeling okay is better than the thought of living for 50 years feeling like this, So.
What is it that they refer to when they talk about wet brain?
Oh, that's just, wet brain is a thing with alcohol, and that's just, see, alcohol, everybody knows about alcohol injuring your liver and causing cirrhosis and damaging your liver and things, but alcohol destroys almost all your organs. It can pickle the heart, it can pickle skeletal muscle, it can pickle your nerves. People get neuropathy, they get numbness in their hands and feet, they get pancreatitis, they get ulcers, they have cardiomyopathy where the heart is flabby and weak, it doesn't beat well, and it pickles the brain. I mean, if you drop a piece of tissue, living tissue, into a vat of alcohol, it preserves it. It turns it from a living thing into a plastic thing. And if you drink enough, if you get high enough blood levels and sustain blood levels high enough for a long enough period of time, you pickle tissue. Pickled tissue no longer functions. It's no longer functional tissue. And the most common things that we see that happening with are peripheral nerves and the central nervous system. So they have pickled brains, and that's wet brain, that's inability to solve problems, it's short-term memory problems, it's cognitive problems. Because just like chemotherapy used to treat cancer attacks the most rapidly growing cells. With alcoholism, it's kind of like chemotherapy on the brain because it's destroying most recent memory. In other words, it interferes with protein synthesis necessary to store memory. And so that's what a blackout is. And kind of an extension of that is wet brain, So this information coming in was never stored. Information that's come in recently is all jumbled up and can't be used. Again, it's like a computer RAM problem. Or now, what is it, DRAM now or something like that? I'm not a computer person. But that's what wet brain is. And if wet brain goes on too long, we call that Wernicke-Korsakoff's or Korsakoff syndrome. And that's where people get into what we call confabulation. They can't think of things, they can't remember things, so they make up things to fill in gaps. At the VA hospital, we had a thing that we don't do anymore called the string sign. You hold your fingers like this and say, what color is that string? They would be compelled to tell you that there was a string there and it was a certain color, even though there's nothing there. As they were too embarrassed to, not come up with an answer. That's confabulation. That's wet brain.